So recently, a lot of our focus has been on COVID-19 vaccines. I'm sure, like a lot of folks, COVID-19
Mhm.
vaccines, testing and treatment. We're kind of winding down from that now, as we're kind of seeing the end come with the end of the emergency declaration, and probably an end to insurance paying for those at-home
Yeah.
COVID tests. We're kind of anticipating maybe a little bit of a wind down of that.
Okay.
But for a long time, for the longest time, that was my role essentially, was dealing with medical billing.
Is everybody thinking that there seems to be a mixed feelings about whether or not the insurance companies are going to cut off the test right at the day of the emergency deal ends? Certainly I think Medicare is paying for it for longer. I don't know what the data is right offhand, but I know they're doing it longer.
Yeah, no, definitely. And, one of the things we've kind of been wanting a little bit more is maybe some information. So
Mhm.
a little bit of a communication from some of these insurance companies. We've gotten the 50th fax, in a month about the rejections and about, overrides. But we
Yeah.
still haven't really gotten that much information about what the end of this emergency declaration is going to look like, what's going to be changing.
Right.
We haven't gotten much of that from the companies, it seems the federal government as well. So we're waiting on that. We're hoping to get some of that. But it's going to be kind of an interesting time, just as we start to transition from this,
Yep.
really well federally funded and sometimes mandated spending to one where it's just like pre-COVID, where insurance companies are going to get to pick and choose what they cover.
Yeah. One of the big things I've worried about is a lot of independents have expanded their delivery during this time, and somewhat reasonably, I don't want to say sloppily, probably more like it should be, not how the insurance company wants it to be, and especially related to signatures. And that's going to be the day after that, they're going to have signatures and everything. And they're going to have to be sending people cards or there have to be how they work that. We're going to try to work that into some type of messaging thing to support it. But I think that's a place
Definitely.
where a lot of people might get in trouble. They're not kind of really on top of their game.
Yeah, 100%. And especially since we've had 2 or 3 years to just hit the impacted by COVID-19 button and just kind of skip past that whole signature step. We've been slowly kind of just forcing ourselves to really get in that habit of collecting those signatures. But we have a few patients who are regulars who are still nervous about entering the pharmacy. They don't want to be touching. They
Right.
don't want to be interacting face to face. And these
Yeah.
are older folks who are sometimes very sick. So it would be very nice if we had an option for some of those folks. But, considering that the end is coming and we still haven't heard much about it, my suspicions is that we're probably going to lose that unless it's brought up and somebody makes a stink about it, which I definitely hope that happens.